can start.
And I think the dean is going to talk.
I'm very pleased today to introduce Senator Barbara Boxer. Throughout her tenure in the House and the Senate, Senator Boxer has been committed to ensuring that our service members, veterans, and their families receive the benefits that they've earned and that they deserve. I hope you know that she's worked to pass legislation that created the Defense Centers of Excellence for Psychological Health and Traumatic Brain Injury. She also helped to establish the Comprehensive Combat Casualty Care Center in San Diego that treats severely wounded service members, and she also serves as the co-chair of the bipartisan Senate Military Family Caucus. Senator Boxer currently has a bill pending in the Senate that would allow taxpayers to check a box on their federal tax return form that would make a donation to programs that benefit homeless veterans. President Obama recently signed her bill with Senator Bond that will allow active duty service members to use our nation's network of veteran centers. I'm honored to present to you a woman who works hard for all of us in California every day, U.S. Senator Barbara Boxer.
Thank you so much. Thank you. Thank you. Woo. Thank you so much. I'm really so happy to be back at USC. I'm so happy to see all of you here. I'm so honored to have these veterans with me. And to the Dean, thank you for that wonderful introduction. I'm so pleased to be here with you and Major Hassan and everyone at the Center for Innovation and Research on Veterans and Military Families. I want to thank everyone for duty to country and what it means to all of us. I just had the privilege of seeing firsthand the great things that USC is doing to train students to better care for our veterans and our men and women in uniform. There are so many wounds that are unseen, and still there are wounds that are deep, and you are working to address that here. I'm impressed with the innovative efforts that are taking place here to speed and improve the training of military social workers. This is so important for our service members, and it is so important for their families, many of whom are coping with the effects of repeated deployments. We've heard people going back 7, 8, 9, 10 times, long separations, and the return to civilian life. When their training is complete, USC students will serve active military members, veterans, and their families and help them cope with the unique pressures and stress that are associated with military life and associated with returning to civilian life. I am proud to have supported this program through congressional appropriations. I worked with Congresswoman Allard, a strong supporter of this program, to secure the funding, $3.2 million, in last year's Defense Appropriations bill. We learned yesterday that the Senate Appropriations Committee included $2 million in this year's bill. It has a ways to go before it becomes law. But I'm going to make sure that that happens. I will give it everything to make sure that happens, because that funding will allow this program to keep growing, to continue to offer cutting-edge training to more students who will serve the needs of our service members and their families. As I've said many times, we can never, ever, ever adequately repay those who have stepped forward and put their lives on the line in service to our country. But what we can do, and what we must do, and what I will always do as long as I have a breath and the power to do it, is to ensure that they have the finest quality of care for injuries that are both seen and unseen. I'm proud to be the co-chair of the new bipartisan Senate Military Families Caucus. I know that too many of our service members are suffering from post-traumatic stress, and too many of our military families are struggling with mental health-related illness. The Department of Defense estimates that nearly 300,000 U.S. servicemen and women deployed since September 11th, 2001 suffer from PTS. And studies have shown that veterans suffering from PTS are at a higher risk for drug and alcohol abuse, depression, and suicide. That is why I've championed efforts to improve the way the Departments of Defense and Veterans Affairs diagnose and treat mental health-related issues, and to secure funding for research into the diagnosis, the prevention, and the management of PTS, of traumatic brain injuries and spinal cord injuries. When I think of our nation's commitment to our veterans, the words of President Kennedy come to my mind. And he said, as we express our gratitude, we must never forget that the highest appreciation is not to utter words, but to live by them. And I want to thank all the students and the faculty at USC who are working to better serve our wounded warriors and their families. You don't just talk the talk, but you're walking the walk every day that you work. And I want to thank again our servicemen and women here today for all you do to protect our great nation. May God bless you and all our veterans and our military, and I thank you. And I'm going to take some questions from the press, but if it's not about this topic, then I'm going to ask our veterans to leave because I don't want them caught up in campaign-related questions. And I have a hunch a couple of you might be here on that. And I will warn you, all of you who are here, don't be shocked by any of these questions, okay? It's sort of not what you want. So I'm happy to take any questions from the press at this time.
Senator,
yeah.
Good morning.
Good morning.